Thank you very much. I think we should move to this second presentation. So if I could ask Eva to introduce that session, and then we'll have a discussion at the end of those talks.
Yes, thank you very much. And during the second part of this webinar, we'll be discussing with you the results of our survey. First one, survey executed in cardiologists, and another one in patients. So this lectures will be provided by myself, Professor Peter Liu, and Professor Jing. Let's now discuss the Revolution Heart Failure International surveys. These are disclosures, potential disclosures from my side related with this presentation. Revolution Heart Failure Program, or real-world education in heart failure program, is really unique, needs-driven educational program, which has been developed by the group of enthusiasts, cardiologists, and patient representatives who would like to provide physicians and patients the program that would fulfill the expectations on all stakeholders in this area. One of the major elements of this program was to develop the survey, which we split into two parts: survey on cardiologist educational needs and survey on patients' needs and perception. And now I will discuss with you the key results of the international survey on cardiologists' educational needs. As you can see here, there were more than 500 responders coming from all over the world, coming from almost 70 countries. The vast majority of respondents were, we can say, middle-aged, and 2/3 of them were men. Almost all responders were physicians with the predominant specialization cardiology, and as you can see here, the 75% of participants had really long clinical experience. Most of responders work in tertiary care or even super specialist centers, and most of them work in public hospital, teaching and non-teaching. We managed to invite in the survey people who are really experienced, who are really work in clinical world during their life, and also focus the clinical work on patients with heart failure. Interestingly, there was really significant heterogeneity regarding the number of personal heart failure consultations per week, either ambulatory or hospital ones. You can see here starting from 6, going even up to 200. But on average, there are around 70 heart failure consultations per week, which are performed by our responders. We asked several questions to our colleagues. One of them was to ask them about the importance of objectives in the management of patients with heart failure. You can see here that obviously prolongation of life, reduction of heart failure hospitalizations are important, but the majority of priorities were assigned to problems that are related with symptoms, functional capacity, quality of life, and being dependent on the others, emphasizing that we should also focus on these problems in our work with heart failure patients. I think it's very promising that almost 90% of our respondents declare that they frequently or even always discuss treatment goals with the patients. We asked our colleagues regarding what are the strongest influences on their clinical practice. It's not surprising that the guidelines and position papers take the lead here. Among the guidelines, there are different. ESC guidelines seem to be very, very important. However, please have a look that in fact we should go also into the geographical distribution of the residency of our respondents, because obviously those living in Europe are more prone to look into ESC guidelines. Those living in America are more slightly keen to go into the American guidelines. Currently, there are two approaches in the treatment of heart failure patients. On the one hand, initiating all guideline managed medications as soon as possible. And on the other hand, the approach which was recommended in the previous guidelines, trying to optimize the dose of recommended treatments. As you can see here, declarations from our colleagues, two-thirds of them is trying to initiate all guideline managed medications as soon as possible, giving the priority to this approach. Important question was also asking people about this conventional sequencing. And as you can see here, this problem may be relevant, but definitively not in all patients. Something extremely important, we see that side effects can limit the optimal implementation of heart failure guidelines. And this is the case here. Many our colleagues have to deal with the treatment-induced side effects. If we want to speak about the implementation of heart failure guidelines, we need to identify the barriers in order to deal with them. Here you can see, we ask our colleagues about different factors which may be potential barriers. We ask them on the one hand whether these barriers are important and ask them to grade them from 1 to 5. So this cumulative score that you can see here is on the one the reflection of the priority to each responder, but also the frequency, how often this barrier was selected by particular responders. So as you can see, on the first place, we can see treatment side effects intolerance, complex treatment, low blood pressure, costs, and low GFR. We also ask our colleagues, if you had the chance to improve your service, what would you do? There are different options. Among those, the most important seem to be to increase patients' follow-up frequency, to improve coordination with primary care physicians, and also to set up a multidisciplinary heart failure team, which I think is not surprising. In the same way, when asking people about the barriers which may limit the optimal implementation of heart failure guidelines, we ask our colleagues regarding the comorbidities, which may be really difficult to deal with during everyday clinical practice. And as you can see here, those which seem to be really problem in real life are chronic kidney disease, coronary artery disease, atrial fibrillation, ventricular arrhythmias, and aortic stenosis. But also there are many more. However, they have not been prioritized here as much as the first 5 ones. We see that maybe in some cases, if we would provide additional resources for the management of heart failure patients, something also could be improved. We provided our colleagues different options, like providing general information about the heart failure, information about diagnostic tests and tools, some other tools which may enhance medical adherence. Details you can see on the slide. Virtually all of them were equally popular here. And also something which is very important in this context, we ask our colleagues about the usefulness of some tools which may be applied in everyday clinical practice. Something which seems to be the most important are the updates and reminders on current clinical practice guidelines, which again emphasizes the role of international reviewed documents. And they are put on the first line in the strategy. So in other words, as you can see here, based on the responses that we got for more than 500 healthcare professionals who live in almost 70 countries, we managed to gather very interesting information regarding the view on the treatment of heart failure patients, regarding the needs, the barriers they may expect. Definitively, these results will provide us important insights into cardiologists' educational needs and would be extremely, extremely important for the further development, the customized and prioritized needs-driven educational programs. So thank you very much for the invitation. And now I would like to very warmly and kindly invite Professor Peter Liu and Professor Yu Zhang, who will share with you this time the results of the patient survey. Thank you very much.